Doing some surface markings here, marking the mid-columella right in the center just to get that midline, along with the midline and the edge of the Cupid's bow right in the center there. And then we're going to mark where our columellar base is, the junction between the nose and the lip, which in her case is right around there. And that's what we're going to measure from. The nose here is kind of deviated a bit, so you can see there's a slight mismatch, like the angle, the trajectory is about like this, so it's not completely lined up, which is very common. Most people have this type of asymmetry, and the surgery actually helps line up the lip with the nose. So now that we have those markings, we're going to do our measurement. This is our kind of more accurate measurement here, and we can see that it's a little longer than 15. Let's try 16 millimeters and see. Yeah, so we're at about 16 millimeters of starting filtral length. Let me see what a 5 millimeter removal would look like here. So take this mirror and sort of angle it like that, so you can see what I'm doing here. And then relax your mouth for me. And can you still see okay?
Yep.
Okay. So now this is the simulation of what things could look like. So this is 5 millimeters of removal. Open a little bit. So you're seeing the front 4 teeth. And, you know, it might drop a little bit, you know, from this, but this kind of gives you an idea. So notice the philtrum shortened, you know, the upper lip more everted and fuller. But I think that this would be a nice look. If you wanted to go for something more than this, I wouldn't necessarily do less than this. I think this is probably a good kind of happy place. The most I would do for you would be going down to 10 millimeters. Sometimes I go down to 9, but it's usually for people who start with an even shorter philtrum. Starting at 16, I would go down to maybe 10. Let me show you what that might look like. So that's 10. So it's a little bit more, not a huge difference more, but a little bit more. This would probably be the maximum of what I would offer you. So could do 5.5 millimeters to split the difference, but that's where I kind of see you, somewhere between the 5 and 6 millimeter range.
Can I see
for
5
excision.
again?
Yeah. A little bit less.
I think
this is
I like more. 5.
So we've completed the upper markings here. This is where the incision will actually hide. And so now I'm going to work on the lower ones. It's a little flatter and wider on the right than on the left. And so that the markings, when I look at them, they reflect that difference, but the measurements are still appearing, they appear quite accurate here. So.